Hey guys, welcome back to Carolina Health Innovations. We're here again with another patient. I'm Dr. Meist and I'm the head chiropractor here. And here's our patient of mine that I've had for many months coming to us, and he was doing great actually. He was on maintenance care. This is Woodrow, but several months ago Woodrow decided to pick up a heavy object and then ended up throwing his back out. Well, it turns out after we evaluated him and sent him, we actually had to send him out for an MRI. It turns out he had herniated a disc. So, for many of you that may not know a lot about chiropractic or what actually a herniated disc is, if you were to sit here and look at this model, basically this is your lower back area. There are 5 vertebrae in your low back, these square guys right here, and your vertebrae are there for support and protection to the spinal cord. In between are actually going to be those discs. And your discs basically help with range of motion as well as they're a shock absorber in your body, kind of like shocks on a car, shocks on a bike. So always want nice, healthy vertebrae. Yeah. Alright. So many of you that might not know about disc issues, basically Woodrow, when he had his MRI done, had an L4, L5 herniated disc. And basically what that means is your disc works like a sponge, and it'll compress like a sponge and bulge outward. And right here, if you can see on the spine, that's showing basically a bulge. And by doing that, it's going to put pressure on the nerve in this area. So when you're looking at the anatomy of the spine, you basically have your vertebra right here, 5 in your low back region. In between are going to be those discs. And we always want nice healthy vertebrae as well as nice healthy discs. When a disc gets compromised, it's basically compressing, going to bulge out, and going to pinch on these nerves right here. And in Woodrow's case, basically what he's having left sciatic pain. It's going all the way down to the foot. And it hurts him, especially when he's sleeping in laying down positions. As you'll see, once we try to put him on the adjustment table, it sends it a shooting pain right down his leg. So our job from a chiropractic standpoint is basically we want to maintain what he has and in time start to improve on that. So we want to build support to this area. So like I told you in some of the other videos when we're adjusting him, pretty much we want to make sure everything is balanced. And what I mean by that, he has different misalignments throughout the body that are also contributing to the nerve pressure. So what we want to do is take the pressure off those nerves. So we're going to be working on his hips or his SI joints, and we're also going to be working on those lower lumbar area. Now we're not going to work on the discs that are herniated, we're going to work on the areas above and below that to protect those areas and support them, and in time allow this area to heal on its own. Alright, we're going to get ready to start adjusting the throat. You going to make it?
Oh yeah.
Okay, he'll make it. Alright, so like we told you before, Woodrow's suffering from basically a herniated disc in his L4, L5 region. So he's having pain going down his entire leg. And his uncomfortable positions, which you'll see in a moment, is always lying down. So sleeping is really uncomfortable for him. He actually has to sit in a chair, and that's the only way he's really able to sleep comfortably. But yeah, there are certain people with different disc lesions, certain different positions are really going to aggravate them. So for him, it's always lying down. So we're going to start adjusting to him. This is a high-low table. So my patients that have trouble lying down onto the table, this table works great. It actually will pop up and take the patient back down, so it makes it nice and easy for them. Also, our older patients who have trouble getting down can also benefit from using this table. So now we're going to take him down. And as you're going to tell,
I'll be screaming in a minute.
He'll be screaming in a minute, exactly. He's going to start having shooting pain.
There it is.
There it is, going down the leg. So what we use is what's called a vibrocussor. This is going to help massage the area, basically around that sciatic nerve. How's that feeling? Is that okay?
It's getting there.
Alright, tell me when.
Actually going down the whole leg.
Yep. So sciatic nerve pretty much starts in this gluteal area, right in the buttocks, and goes all the way down the leg and splits off when it hits the calf into 2 other nerves. So basically any associated muscles, ligaments, and tendons that are surrounded by that nerve can get affected from the sciatic issues. Any pain, tenderness? Or is that starting to feel better?
It's starting to go down a little lower.
A little bit lower.
Yeah.
So as you can see. Alright. So you can only handle this position real quickly. So we're going to start working on him. Now like I told you before, we're looking for misalignments in the body. And with him, I don't know if you can tell, you can see that his hips are totally unleveled right now. So what we're going to be working on is this right hip. We're going to be doing a drop table technique where I'm going to be applying force to that area with my body weight in the force, put the bone back into its proper place. And we only have a little bit of time with him. I'm going to do it again. Now his other hip kind of flares out, meaning it's going to kind of rotate this way, so we want to balance that area out as well. So again, we're going to be applying force to that area with my body weight, putting everything back into its proper position. How are you doing, sir?
Alright.
Alright. Now we're going to relax his leg again, because again, all his muscles are getting really irritated. You tell me when. Better? And this little device works great. As you can tell, it really relaxes him. And he's able to go through the entire adjustments, where before he wasn't able to handle it at all. Better? Better?
A little better.
Good?
Pretty good.
Alright. Now we're going to start working on his lumbar area. Now remember, L4 and 5 are the ones that are affected, so we're going to work the areas above and below that. So, with him, I've already worked the hips, now we're going to be working the L3 region. Take a deep breath in, and breathe out. How you holding up, okay? Deep breath in. We usually do this about 3 times to that area. Have the patient take a deep breath in and breathe out.